Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Bakht. Today we are going to discuss one of the anti-hypertensive medication. That is the medication which is used for the high blood pressure, and it is amlodipine. Its name is amlodipine, which is commonly used anti-hypertensive medication. This amlodipine is a calcium channel blocker. It is a class of the medications which are calcium channel blockers. Calcium channel blocker. This group is also known as dihydropyridine. Dihydropyridine group. One of them is non-hydropyridine, which is also calcium channel blocker, but this is the dihydropyridine, which is a different class of medication. So amlodipine, or the calcium channel blocker, is used for the high blood pressure. And how it works, it blocks the calcium channels. That's why it is called calcium channel blocker. This medication is available with different brand names. The common is Norvasc, Vasodilation, are different trade names, and it's available in a strength of 2.5 mg, 5 mg, and 10 mg. The indications are high blood pressure, angina. Indications are hypertension, that is high blood pressure, angina, which is pain of the heart. So how this medication works, or what is the mechanism of action of this medication? It's also available in the oral suspension form at 1 milligram per ml strength. So it decreases the blood pressure, this medication, and decreases the risk of fatal and non-fatal cardiovascular events like heart attack, like myocardial infarction, or stroke, which can be prevented by the use of amlodipine. Now we want to know how the amlodipine decreases the blood pressure. It is also called mechanism of action. So we want to erase this and to write down how does the amlodipine works. How does it work? What is the mechanism of action of amlodipine? First of all, we should know about the calcium channel. We say it is a calcium channel blocker. So we want to know what is calcium channel and what is the purpose of calcium channel. We have blood vessels in our body. In which blood flows inside the blood vessels. There are arteries. There are calcium channels in the smooth muscle wall of the arteries. Now if we look at it macroscopically, it somehow looks like this. These are the cell membrane, and inside the cell membrane there is a channel, make it the green, somewhat like this. Different units are here, alpha subunit and beta subunits. We're making the cell membrane, and also there is a channel called calcium channel. So the membranes somehow looks like this. they are present in the calcium channel are present in the smooth muscle of blood vessels and also the heart muscles. Now what happens when the calcium ion it comes here, it is attached with the alpha subunit of the calcium channel. This is the calcium channel. You can call it calcium channel. This is an ion channel. And what happens when the calcium comes here, what happens, it opens and there is a influx of calcium. Influx of calcium. The calcium comes here and calcium combines with a protein which is called the calmodulin, and it makes the calcium calmodulin complex. It makes the calcium calmodulin complex. What happens, this calcium calmodulin complex, it activates an enzyme which is called myosin light chain kinase, which is called it activates an enzyme called myosin light chain kinase, which activates, or we can say convert, myosin into myosin phosphate. Myosin phosphate. This myosin phosphate interact with the actin, which is a thin fiber of the muscle, and it causes vascular smooth muscle contraction. It causes vascular smooth muscle contraction. Vascular smooth muscle contraction. And it narrows the arteries, or we can say contract the arteries. So if we explain it again, amlodipine works on these calcium channel. This is the cell membrane of the blood vessel, just like arteries, and also this type of membrane is present in the heart. And there's a channel called the calcium channel, which is an voltage gated channel, and it is called calcium channel because the calcium enters here and there is influx of calcium. Calcium combines with a protein called calcium calmodulin. This complex is formed, and this activates the myosin light chain kinase, which convert myosin into myosin phosphate. It interact with the actin, the light chain of the muscle fiber. It causes vascular smooth muscle contraction. Now amlodipine blocks this mechanism. What the amlodipine does, the amlodipine, it is attached here with the alpha unit of the calcium channel, and what happens, this channel is blocked. When this channel is blocked, what happens, there is no influx of calcium channel, there is no formation of the calcium calmodulin complex, there is inactivation or no activation of the myosin light chain kinase. Myosin is not converted into myosin phosphate, and there is no interaction with actin and no vascular smooth muscle contraction. So what happens, there is vasodilation. Instead of the contraction, the blood vessel dilates, and when the blood vessel is dilated, what happens, we can imagine very easily that when the blood vessel is dilated, the blood pressure decreases because the velocity of the blood decreases inside the artery. So when the amlodipine combines here, what happens, there is dilatation of the blood vessels, and it is called vasodilatation. This is called vasodilatation, and in this mechanism the blood pressure decreases. Now what is the strength of this medication? We say it is available in different strengths. We say it's available in 2.5 milligram, 5 milligram, and 10 milligram, and depending on the severity of the blood pressure, we advise this medication accordingly. So as we discussed, this indication of this medication is for the high blood pressure and also for the angina, that is coronary artery disease. Now we want to discuss some of the adverse effects of the amlodipine. What are the adverse, or some people call it side effect in layman term, adverse effects? Now, adverse effects of this medication is based on the same mechanism of action. As we said, it causes vasodilation besides allergy. For every medication, we advise the patient that if he is allergic to the medication, everyone is not allergic to medication. Some of the individuals are allergic to the medication, and if there is any type of allergy in the form of rash, in the form of breathing, so they must stop the medication and report it to the doctor. If it is severe allergy, they should come to the hospital immediately. Now we say the side effects of the amlodipine. So we divide it like on the basis of the percentage, how many people are getting the side effects. So edema is the most common side effect. And what is edema? Swelling, and mostly swelling of the dependent parts, that is the lower limb. The lower limb edema, because this area is dependent and the blood can pool easily. So what happens when the blood vessels are dilated, when we say it causes the vasodilation, when the blood vessels are, there are pores in the blood vessels and they get open because of dilatation, and water is coming outside of these pores. Water is coming outside these pores, is accumulated inside the skin, and it becomes big like this. We say it can be dilated, and it is a pitting edema. Pitting means when we press this area with the thumb, so there is a depression. A depression forms here. It is called pitting edema. And when there is no depression, like the patient with hypothyroidism or mixed edema, the depression is not formed when we press this area. So when this depression is formed, it means there's a water in this area under the skin, and it is called edema. So this type of side effect, the edema, is common. It is in more than 10% of people who are taking amlodipine. But they should not stop this medication because of this, and they should report it to the doctor. Then we can change the medication if it is bothering, and we can decrease the medication. We can give an alternative medication, but they should not stop it immediately. Some patients get used to with this side effect, and when the edema is more, we ask the patient to put a pillow under the lower limbs while they are sleeping, so the edema is reduced. Other side effects are less common, which include headache. Patient can have fatigue, they can get tired, there can be palpitations. And why palpitations happen? Because of the vasodilation, there is reflex tachycardia. Because the blood pressure can be decreased, and because of the decrease in blood pressure, there is compensatory phenomena. Sympathetic activation happens in the heart. It beats more faster. There can be dizziness. And why the dizziness happens? It is mostly when the patient take the medicine for the first time, and it can be hypotension, decrease in blood pressure when the patient is not used to with the medication. It can also have nausea and flushing of face. Flushing of face is the same mechanism. When the blood vessels are dilated in the face area, so what will happen? The face will become more red. So flushing is more common. Muscle cramps also, and in some condition, male sexual infertility is also common. Another question about this medication, as we said, it is a commonly used medication. So another important question is whether this medication, the amlodipine, can be used in pregnancy or not. There is no proper enough data available which can say there is any adverse effect or any congenital problem any malformation. So we do give it to the patient of hypertension, because if a patient is having high blood pressure during pregnancy, it can lead to a condition called preeclampsia, and the preeclampsia can lead to eclampsia, seizure, fits during pregnancy, and it can lead to premature delivery, and also growth retardation inside the uterus, which is called intrauterine growth retardation. So during pregnancy, we can give it, but we must be careful. Now, question is about lactation. In the lactation period, lactation means when the mother is giving breastfeeding the baby. During lactation, like, there is no evidence of any harm effect of the amlodipine on the infant, though it is secreted, so it can be given during lactation. So it was about the amlodipine, the calcium channel blocker, which is called dihydropyridine. And as we discussed, it's a protein inside the membrane. It's the membrane spanning protein which regulate intracellular calcium. It is present in the blood vessel, the smooth muscles of the blood vessels, and it gives to contraction of the blood vessels. And when we block this with the calcium channel blocker, that is the dihydropyridine group, that is the amlodipine, what it causes, there is no influx, and as we discussed earlier, the mechanism which is activated when the calcium gets inside, so that mechanism is blocked, and there is vasodilatation of the blood vessel, and it can lead to the our target action, which is called decrease in blood pressure. So this medication is used for hypertension, and it decreases the blood pressure in this way. We start the medication initially, like in adult, with 5 milligram. Those who are having hepatic impairment with the liver problem, we start with the 2.5 milligram initially, but initially we start with the 5 milligram. And if we cannot get the target range of blood pressure, we gradually increases 2.5 milligram per day for 7 to 14 days, and gradually we increase it. The maintenance dose of the amlodipine is 5 to 10 milligram per day, and we ask the patient regularly to check their blood pressure as well. Next important point is the patient should check their blood pressure at least 2 times a day if it is controlled, in the morning and in the evening. And sometimes we cannot get a target goal with one medication, then we combine other medications, other class of medications, or we increase the dose of this medication, but the maximum limit is 10 milligram per day. We should not increase this medication above 10 milligram. And if the patient blood pressure is not controlled even with 10 milligram per day, then we combine it with another medication. Different combinations of blood pressure medications are available. We try to change the lifestyle of the patient, like regular exercise and proper healthy diet, along with the medications. We combine with other medication. If it is not controlled with 2 drugs, we combine a third medication. So it was all about the amlodipine. Now these small presentations are only for the educational purpose for those people who are already taking amlodipine, to get more aware about the amlodipine. But it's not like for everyone. The aim of this presentation is not that the patient who is hypertensive, he has not seen a doctor and they should go to the pharmacy and get this medication. No, it is a big no. The reason is, we first of all evaluate the patient, whether the medication is suitable for the individual patient or not. We decide for each patient individually. So no one is advised to go to the pharmacy and take this medication. They should go to the doctor evaluate. We individually see the patient, and individually we give medication to the patient. So thank you so much for watching and listening. We will make such presentations, small presentation, for the awareness of the community. Thank you so much. Bye bye.